All right, residents, today we're jumping into a really high-yield, clinic-oriented playbook for one of the most powerful behavioral tools you have, activity scheduling. And look, this isn't going to be some dry, theoretical lecture. This is a practical guide you can start using with your patients like tomorrow. So, let's set the scene. You're in clinic. A patient looks at you and says, "Doc, I have zero motivation. I just can't get myself to do anything." We've all been there, right? It's probably one of the most common and honestly most challenging things we hear. So what's your next move? What's the evidence-based play here?
Well, it's this, activity scheduling. And let's be really clear about what this is and what it isn't. This is not just about giving your patient a to-do list to keep them busy. No way. This is a structured, targeted intervention. Its entire purpose is to systematically fight that avoidance and, this is the most important part, to restore their sense of control and mastery over their own life.
So here's our game plan. First, we'll get into the why, the clinical rationale. Then, we'll walk through the 5 key steps to actually implement this. After that, we'll unpack the huge insight of mastery versus pleasure. Then, we'll talk troubleshooting for when things go sideways. And finally, we'll cover how to nail the follow-up visit.
Okay, first things first. None of this works if your patient isn't on board. Getting their buy-in is everything. And that means you have to clearly and convincingly communicate the core principles behind this whole thing. I kind of think of these as the rules of engagement.
These 4 rules are absolutely crucial to set up front. Number 1, and this is a huge paradigm shift for most patients, action comes before motivation. We're not waiting to feel good to do something. Number 2, we follow the clock, not our feelings. If it says 9 a.m. on the schedule, that's what we follow, regardless of how we feel. 3, the goal, especially at first, is effort, not enjoyment. We're celebrating the trying. And finally, number 4, you have to normalize discomfort. It's probably going to feel weird or anxious, and that's okay. Perfection is absolutely not the goal here.
All right, let's get into the nitty-gritty. This is the how-to, the part of the playbook you can literally use in your next session to get this off the ground.
Okay, 5 steps. Step 1. Start with a baseline assessment. Just have them map out a typical day, hour by hour, so you can see where the empty spaces are. Step 2, identify different domains, self-care, work, social stuff, leisure, so we can aim for some balance. Step 3, and this is so important, grade the activities. Break them down into tiny, specific, achievable tasks. Then, step 4, you fill out the first schedule with them. This has to be a team effort. And finally, step 5, you introduce the rating system for pleasure and mastery. And this is a perfect example of what I mean by grading the activity in step 3. Clean the house is huge. It's overwhelming, it's vague, and it feels impossible on a bad day. But sweep one room from 9 to 9:30 a.m.? That is specific. It's time limited. It's achievable. That's the level of detail we're shooting for.
Okay, now we're getting to what I think is the real magic of this whole thing. Seriously, if you can get your patient and yourself to grasp this next concept, it's a total game changer. This is the key that unlocks progress.
It's so simple, but it's incredibly powerful. We're going to have them rate each activity on 2 different scales, from 0 to 10. The first is pleasure, or P. That's easy, right? How much fun was it? The second, though, is mastery, or M. This measures something totally different. It's that sense of accomplishment, the feeling of "I did it," that comes from putting in the effort, even if it wasn't fun at all.
Just look at this sample log. Sweeping the room, pleasure rating of 1. It was boring, it was a chore. But look at the mastery score, an 8. Why? Because they did something hard when they didn't feel like it. Same for the walk. Almost no pleasure, but a mastery score of 7. This is the win. In the beginning, we are chasing the M score, not the P score.
Okay, so obviously this isn't always going to go perfectly. In the real world, things come up. So let's talk about the most common hurdles you're going to face and how to handle them, so you feel confident no matter what the patient brings back to you.
This is, without a doubt, the number one thing you're going to hear. Your patient comes back, the chart is mostly empty, and they say, "Yeah, I know we planned it, but I didn't feel like it." So what do? How do you handle that without being critical?
Your first move is to normalize it, 100%. You look them in the eye and say, "Of course you didn't feel like it. We knew that was going to happen." You completely validate their experience. Then you gently remind them of the rule, action before motivation. And from there, you pivot. You say, "Okay, that task was too big. Let's make it even smaller, so small that you can't fail to get that mastery point next time."
So here's another classic. The patient with perfectionistic traits or OCD comes back, and their schedule is beautiful, it's color-coded, it's packed from 6 a.m. to 10 p.m. It looks amazing on paper, but you know it's a recipe for burnout. What's your move?
Your job, therapeutically, is to actually pump the brakes. You have to help them reduce the schedule. It feels completely backwards to them, but you explain, hey, the goal here isn't to create the world's most impressive to-do list. The goal is to build a foundation of success that we can sustain. We are trying to avoid overload at all costs. And here are a few other quick ones. For any non-adherence, your default is always to review without judgment and make the task easier. If you have a patient who starts ritualizing the charting itself, you can set limits, like you can only use the pen once per box. And for those well-meaning families who try to jump in and take over, a little psychoeducation goes a long way. Their job is to be cheerleaders, not coaches.
Okay, last section. Let's talk about the follow-up visit. Because honestly, what you do when the patient comes back is just as important as how you set it up. This is where you lock in the learning and really build that forward momentum.
So when they come back in, here's the drill. First, you review the chart together, side by side. Your eyes should immediately go to the mastery scores. You're looking for patterns of effort, not focusing on the empty slots. You praise the simple act of starting something. You praise them for tolerating the discomfort. And this is a big one. Try to praise the behavior, not just the outcome. So instead of great, you feel less depressed. Say, it's amazing that you went for that walk even when it was hard.
And here's a really important clinical pearl. If a patient is just getting crushed, if they feel totally overwhelmed and they keep missing their targets, the smartest and most therapeutic thing you can do is pull back, reduce the schedule, maybe even go back to just monitoring their day for a week with no scheduled tasks, just to rebuild their confidence.
So let's boil it all down. If you walk away with just 4 things, let them be these. 1, this is a behavioral tool, not a motivational one. 2, making tasks simple and achievable is in itself therapeutic. 3, mastery comes before pleasure. That's the sequence. And 4, the single biggest predictor of whether they'll stick with this is your collaboration with.
I'm just going to leave this on the screen for a beat. This is the mantra. This is the core principle that drives the whole intervention. If you can get your patient to truly believe this, that the feeling of accomplishment comes first and the fun comes later, you're going to see real change. Mastery precedes pleasure.
And that brings us to the end. So I'll leave you with a question to take with you into your next clinic. Based on everything we just talked about, what is one small, specific, and achievable task you can schedule with your most stuck patient this week? Think about it, and then go make it happen.